Well, we're going to begin our spa cupping course with working on the client's face. We're going to employ several different methods. The first method is going to be the standard lymphatic clearing, which we use to open up the lymphatic ducts so that when we work on the face, we have an open channel for all the lymphatic fluid to drain out. The next one we're going to be doing is TMJ, followed by sinus, and we're going to end with facial rejuvenation. My clients absolutely love getting their face worked on. It doesn't make any difference what their background is. They come in and the first thing they say is, "Will you work on my face today?" And I say, "Sure." So hopefully you'll be able to incorporate this with your present day spa business and give them a modality that really works. It's an ancient treatment, but it has amazing results. So let's get started. I prefer using on the face glass facial cups. They provide a greater degree of suction and a very smooth glide, a lot more so than the silicone cups. So for professional use, I would recommend the glass cups. Glass cups tend to be a little bit cooler, so I always let my students know to warm those up in your hand before you even begin working with your client. And there's another trick to working with these. You don't want to just put this cup on your client's face or near it, create suction, which causes a little wisp of air to come out, and it's very alarming to your clients. So you want to go ahead away from the client's face to depress the bulb and then apply a cup to your client's face, no matter which one of the bulbs you're going to use. When working on the face, there's a couple of contraindications that you need to be aware of. If the clients have rosacea, the pinkening of the skin, psoriasis or eczema, those clients are not a candidate for any type of facial cupping. If they have an outbreak of any hives, urticaria, any cold sores, you also want to stay away from that. Clients that have had facial melanoma, any type of lesions on their face that you're not sure of, once again, those are not candidates to have facial cupping. So today, a lot of clients, and they really don't want to be forthcoming with this, but you have to let them know it's very important that they do disclose if they've had any cosmetic procedures done on their face to use Botox. You do not cup a Botox for 2 months after the injections of the Botox. Some therapists do cup after a month, but I always err on the side of caution and I wait 2 months. I also would check with their doctors. And not everyone gets Botox on the lines on their face, on their forehead. Some of them are getting it for migraine headaches, and we do go around and work at the base of the neck. So you have to make sure that your client is not using or having any Botox injections. The other one we have to be careful of is if your client has had any facial reconstruction. A lot of times they put in fillers, which is the Juvederm down here, and you don't want to start moving any of the fillers around. So really be honest with your client and have them communicate with you honestly if they have any issues that they've had treatment for on their face. And last but not least is if they have any severe edema or kidney issues. You want to make sure that you're not overloading those kidneys by draining the face. So know the medicines your clients are taking. Make sure that they are not having any kidney issues. Also, women during their monthly cycle can be prone to the redness of the skin. They may not have rosacea per se, but they can have a reaction to the cupping. So just kind of feel them out and ask them a question, where are you at during your cycle? All right, so here we go. We're going to begin. When you cup the face, you always want to start on the right side. And you're wondering, why would I start on the right side? And it's because of the flow of the lymph system. The right side drains all the way down, drains the head, the face, the neck, and it drains down to the main duct right here just above the nipple on top of the breast. The left side drains the rest of the body. So when you work on the face, you always want to start off on the left side, on the right side. So before we even start, I'm going to take a little bit of my lubricant, and once again, make sure you are ample with your lubrication. If you are not, these cups can tend to drag. And I just noticed I have my rings on. So when I do work on the face, I want to make sure that my rings are off. I don't want to have an accident and scratch my client's face. So I'm very protective of my clients. So we're just going to put those rings over here. There we go. All right. You doing okay? Don't have anything I have to worry about?
No.
Okay. All right. So she's well lubricated. This is a little jojoba oil, which mimics the natural oils of the face. So now we're going to come in, pick up your client's head, and just relax your neck. I'm not going to tell you to do the chiropractor. We're just going to lay you off to the side here. So when we do lymphatic drainage of the head and face, we always want to start with the largest cup possible. Sometimes we have to drop down to the next cup, and it depends on if the client is extremely tight along the SCM and you aren't able to get a nice suction. Sometimes if you take the head over too far, the side of the neck becomes a little tight, and once again, the cups aren't going to create suction. And in that case, you just need to move the head back slightly, and you can usually get your cup to work. So we're going to try the large cup to see how we go. She's very tiny, so we may have to go down a size. You want to make sure you get your the hair out of the way. And you're going to start right behind the ear, in line with the occipital ridge, and create suction. See, she's really tight. Let's loosen her up a little bit. Let's see if that can work. There we go. And release. Press your bulb, suction, and release. This is done fairly rapidly. You don't want to ever, there's certain things you don't want to do when you work on standard lymphatic clearing. You never want to go crossways. That is absolutely a no-no. Also, you don't want to ever glide the cup up, and you always want to drain down and make sure that you're draining out to the axillary area. So what I would like to see is I want to get it to the point where I can really slide my cup. So sometimes women have, they've worked out at the gym, they're really tight. In that case, it may take several rounds of suction and release under the clavicle to loosen it up before you're able to glide that cup. Also, if a woman is really well endowed, sometimes it creates a lot of tension on their chest muscles, the pecs, and it can be really hard to loosen that up. Once again, several passes of suction and relief before you glide the cup. So as we begin, we're going to make one more pass. Loosen you up a little bit more. We're just going to go get a smaller cup here, make it easier. Suction and release. We use the larger cups because it really protects the neck, because it's not an isolated pressure, it's diffused. Oh, we're now sliding. Got a nice slide here. Good. All right. So this is the beginning procedure before you do any type of facial work. I just wanted to go over exactly what we did for clearing out the lymphatic system on the face. The first thing you're going to do, make sure you lubricate your client thoroughly. You're going to turn the client's head to the side. You're going to pick a cup size appropriate. The larger cup is the best. You're going to start suctioning behind the ear, making sure that you depress the bulb before you come to the client's face. Suction, suction, suction. Come down under the clavicle. Suction, suction, suction. Drain it into the axillary area. If the client is very tight in the chest area, you may have to do several rounds of suction and release before you are able to glide the cup itself. After you've finished, you can do another round depending on your client. If your client has a lot of edema in their face, then you can do 2 to 3 rounds of clearing before you even get started. Make sure that when you do any type of work on the client's neck, that you only suction and release when you go down. You never want to glide the cup downward, and you never want to cross the cup across the base of the neck on the scalenes. Cups are very powerful, and we have to be very careful when we use them on the neck. But they're a great tool to use to drain the client's face of any facial edema and prepare them for the next cupping treatment that they're going to get.